Hey guys, Lance here. So two questions we get asked a lot are, what is Medicare Part D and how does it work? Basically, Medicare Part D is a prescription drug benefits option that the United States government provides for people that are enrolled in Medicare. It's designed for people who are enrolled in original Medicare, Part A and Part B, to help pay for their prescription drugs. So for anyone who is not totally familiar with Medicare and how it works, that's okay. I'll go through just a quick recap, but for a more in-depth video on Medicare and how it works, we have a helpful link below if you need some more information on that. So the original Medicare program is made up of three main parts, Part A, Part B, and Part D. Part A is your hospital and skilled nursing facility coverage. Part B is your medically necessary services, such as doctors, tests, and medical equipment, and preventative services like vaccines. And then Part D is prescription drugs benefits, and the three options together make up what is called Original Medicare. Now, how much you will pay for each of these parts will depend on your individual or household income. Now, there are a few things to know about your Part D prescription coverage, and those are what it covers, how much it covers, and how much the deductible might be. So for starters, it's also important to know that there are 4 phases involved with your prescription coverage, and the amount you will pay will depend on the phase you're in and the type of medications you're taking. So in this video, I'll be going through all the basics you'll need to know about Medicare's Part D prescription drugs option, and I'll break down what each of the 4 phases are, the different medication types or tiers, as they're called, and what the costs might be, and try to make things as simple to understand as possible so that ultimately you can better understand how Medicare's Part D prescription drug option works. And then I'll be sure to include any helpful links in the description below this video. So if you need more information about Medicare, it will be there for you if you would like to learn more. Okay, so now that I've recapped what Medicare is and how it works, let's get right to the basics of Medicare Part D. So as I've mentioned, it's designed to work with Original Medicare, Part A and Part B. There's also Medicare Part C. So I would also like to mention here that if you choose Part C, that Part C usually has its own prescription benefits that are subsidized by private insurance companies. So Medicare Part C is an alternative way to receive your Medicare benefits. So just keep that in mind if you choose Part C. You would have your own prescription benefits plan separate from Part D. So for starters, one of the benefits and main reasons that most Original Medicare recipients choose the Part D option is because Medigap plans do not include prescription drug coverage, so you may want to consider a Part D plan to help with prescription costs. Now, the monthly premium of Part D can be between $15 and $90 per month, depending on the plan, and also some of the medicines might cost a copay amount when you get them too, as well. So if your individual income is over $88,000 or $176,000 on a joint tax return, you may also have to pay a Medicare premium in addition to your plan premium. But it's best to speak with a licensed Medicare insurance advisor to confirm what plans cover the prescription drugs that you need and how much you will actually have to pay. Okay, so what exactly is a Medigap plan? Well, since I mentioned it, I'll briefly describe that here. Typically, people with Original Medicare often choose to structure their Medicare options with Part A, Part B, Part D, and a Medicare supplement plan, which is the same thing as Medigap. So you can use the two terms interchangeably. Medigap plans help pay for what Medicare doesn't pay for. So put simply, it helps cover the gaps. And there aren't any gap coverage options to help with prescriptions. So that is one of the benefits of choosing Part D. However, if your income is very low, there is a program called the Medicare Extra Help Program, which is designed to provide financial assistance for prescription drugs to people who have Medicare. It's also called the Part D Low Income Subsidy. This financial assistance is based on your income and level of financial need. Now, this federal Medicare Extra Help Program covers prescription drugs only, and it's different from state-sponsored Medicare savings programs, since a lot of people who qualify for Medicare Extra Help often don't even know about it, and that's something for you to keep in mind if you make less than $19,320 as an individual, or if you make less than $26,000 $130 together if you're married. And that is the amounts set for 2021. So it does change each year, something to keep in mind. And for more information about the Medicare Extra Help Program, you can take a look at the video below to find out more as well. Okay, so another one of the benefits of Part D includes some home delivery options. Though there are some policy limitations, in most cases you can choose how you receive your prescriptions, depending on the medication and your policy in particular. Besides traditional pharmacy pickup, these choices include having your prescriptions mailed to you as well as home delivery. But of course, it depends on your policy location and the medication. If it can be delivered or mailed to you, so just keep that in mind. Home delivery and mailed prescriptions really do come in handy if driving is an issue though. So this is just a really great option to consider. You may also even have the option to set up your prescriptions to automatically be delivered each month as well. And you may have to sign a prior authorization form ahead of time. So if having mail delivery or home delivery options are something that appeals to you, you want to make sure to know ahead of time what your policy says. Another thing that's important to keep in mind is that there is a late enrollment penalty if you don't sign up for Part D during your initial enrollment period, unless you have your own prescription coverage from another source that is equal to what Medicare covers, like private insurance, insurance from an employer, or your spouse's insurance might cover you, as an example. So if you miss your initial enrollment period and your previous prescription coverage hasn't been active for 63 days or longer, you will have to pay this penalty, which is a higher monthly premium that you'll have to pay for as long as you have Part D prescription coverage. And how much that penalty is depends on how long you went through without coverage. So that's something to definitely keep in mind. Okay, so next, as I mentioned before, there are 4 phases involved with Part D. So let's talk about those next. These 4 phases are the deductible phase, the initial coverage phase, the coverage gap phase, also known as the donut hole, and finally the catastrophic coverage phase. Now, it's important to know that it's entirely possible to only ever make it through the first or second phase, as most people never make it past the second phase, which is a good thing. However, as I'm going to talk about here, the medications you are on will either help keep you from having a coverage gap, or they may cause you to reach that gap. So we're going to talk about that in just a minute to hopefully help you avoid that donut hole. So to start, your deductible phase is the part that you have to pay before your insurance begins to pay. This deductible can vary based on the plan, and an average can range from $300 to $400 per year. But Medicare dictates that this can be capped at a maximum of $445 per year, which is the amount set for 2021. There are also some Part D plans that offer a $0 deductible. So you will only be responsible for a set copayment and coinsurance when collecting your prescriptions. Your copayment will be a set dollar amount, and your coinsurance will be a percentage. In some plans, a deductible only applies to certain tiers on prescription drugs. And this is where you will want to discuss with your doctor about possible generic medication options. So there are Tier 1 and Tier 2 medications known as generic medications, or often referred to as off-brand medications. You can simply think of those as preferred or low-cost medications. Then there are Tier 3 and Tier 4 medications, which are going to be the name brand or higher cost medications. Now, when you're taking these higher cost medications, your plan is going to charge you a higher deductible and a higher copay or coinsurance, and you're going to use up your total yearly coverage amount much faster because Medicare has coverage limits, which I'll be talking about more in depth here in just a moment. Now, that coverage limit is the total combined of what both you and your plan pays together toward your medications, not just what your plan pays alone. So during your deductible phase, if you are using Tier 1 and Tier 2 generic medications, you'll have a very low copay or coinsurance on most of these medications simply because the cost is so low. And as I mentioned before, using these preferred medications will likely help you find a plan with a $0 deductible because, again, the cost of these medications is so low. And if that's the case, you would basically move from the deductible phase right into the initial coverage phase, which I'll be talking about next. Now, again, if you are taking tier 3 and tier 4 medications, the name brand expensive medications, you may want to talk to your doctor about switching to generic or to their generic equivalent. With these name brand medications, you can usually expect higher deductibles, higher copays, and coinsurances, and you're at risk for reaching Medicare's coverage limit. And I will tell you more about that here in just a moment as well. Now, once you have met your deductible, you will move into the initial coverage phase, and your Medicare Part D plan will begin to pay your drug costs up to a certain amount of coverage if you had a $0 deductible. If you had a $0 deductible, then you basically started out here. So within this period, you will still continue to pay a co-payment, which is a fixed amount you'll pay when you pick up your prescriptions, or you'll pay a co-insurance, which is a percentage of your prescription drug costs. The total coverage amount changes each year, but in 2021, Part D plans covered up to $4,130 per year within this phase. And as I mentioned before, this is an overall total of what both you and Medicare put into your prescriptions, or the total cost of what your prescriptions cost for the year. Okay, so by using generic medications, chances are you'll never reach your coverage limit. However, if your medications are the more expensive name brand tier 3 and tier 4 medications, your chances of reaching your coverage limit are much higher. Now, if you happen to reach this coverage limit in your initial coverage phase, you'll move on to the coverage gap phase. This is often referred to as the donut hole. The good news is 90% of people will never reach this phase, but if you do, you will usually have to pay a 25% co-insurance payment for all your prescription drugs, and your plan will pay the rest. And there aren't any supplement programs or savings accounts to help with this unless you bought Medigap coverage before 2006. But they haven't offered any since then, so there really aren't any options to help with this now. Thankfully though, this coverage gap is limited. And once you reach a spending amount of $6,550 total for the entire year out of your own pocket for your prescription costs, you will move out of this coverage gap and into the next phase. The next and final phase, Medicare will begin to cover your prescription drugs again, and you will usually only be responsible for a small copay or coinsurance in this phase. But again, only about 10% of Medicare recipients ever make it to the third or fourth phase or have to worry about a coverage gap. So that's the good news. And it's also important to make sure you choose the right plan when enrolling in Part D, because there's nothing more painful than collecting your prescription drugs only to be served with an expensive, unexpected bill. So make sure your licensed insurance agent is aware of all the prescription drugs and brands you take so they can help ensure you are on the right prescription drug plan for your personal circumstances. And you can always talk to your doctor about possible generic alternatives, because that's the first step to find a $0 deductible plan and also to avoid that donut hole as well. Okay, so hopefully you feel more familiar with the Medicare Part D prescription benefits option and how it works now, and you can choose your plan with confidence. And although it might be a little overwhelming or confusing at first, we're here to help you find the information you need for yourself or your loved ones. And again, we'll post any helpful information in the links below, so feel free to take advantage of that. Also, if you have any question, don't hesitate to post those down in the comments below as well. And if you would like to speak with a licensed insurance agent, I'll post a phone number down in the description as well. Feel free to call this number. It's toll free. You can call anytime, and you can speak with someone one-on-one on the phone who will be happy to answer any questions you have. They'll also be happy to help suggest any advantage plans that might be a good fit for you, or at least make suggestions. They can take a look at what you're currently, either plans you're currently on, or if you're new or newer to enrolling in Medicare, they can help give you a list of options to consider as well and see if something might be a good fit for you. So again, feel free to take advantage of that if you like. But otherwise, thanks so much for your time. I really appreciate you guys watching, and I'll look forward to seeing you in the next video.